So I will try to be as brief as possible. So die hard in double trouble means that we have both iridiodialysis and zonulodialysis. We will deal with them separately, and then again, and I'll try to show you my way of doing it, which I've just found out. So to begin with, we have a galaxy of speakers, Dr. Ayanmont and Dr. Arubhomik from Disha, Kolkata. We have Kumar J. Dr. Sir from all the way from Andheri, West Mumbai, from Dr. I Institute, Dr. Meena Chakraborty from Chakraborty Eye Institute, Trivandrum, who manages the posterior segment out there, and Dr. Boris Maligan from Fordrov Eye and Eye Microsurgery Complex, all the way from Moscow. He may not be, he's on the move. He may have sent me his presentation. So if he cannot join in, I will play his presentation. So going directly to ciliary sulcus, which is the point of interest where of all sulcus fixated lenses. What is ciliary sulcus? Is the potent space in between the iris, posterior surface of iris, and the anterior surface of ciliary body and the lens. So this is the lens sitting in the ciliary sulcus. This is the ciliary sulcus proper just in front of the capsule. So this is what we intend, ab interno, entering through the ciliary. Let me take the pointer. Entering ab interno and coming out through the surgical limbus. So this is what we intend. This is the pathway from the sclera to into the ciliary sulcus, but it is not so easy because this is a blind procedure. Let us first understand the limbus. This is the cornea. This is the sclera. In between, we have the limbus, anatomic limbus at the conjunctiva, surgical limbus. And now we have is between divided into white zone, blue zone, and then white zone. In between, we have the mid-limbal line at the decimus membrane, end of the Swallows line. And end of the white zone signifies the end of the surgical limbus. So what is the dilemma here? This is a blind procedure. We cannot see the ciliary sulcus through the microscope. So we need an indicator on the scleral surface to make us feel secure that it has gone into the ciliary sulcus. So we need an important landmark. So the location, this is the iris, this is the ciliary sulcus. Ciliary sulcus is 1.5 millimeter deep from the sclera perpendicularly. And if you go parallel to the surface of iris, posterior surface of iris, it will go for about 2.5 millimeter and hit the sclera about 2 millimeter behind the posterior surgical limbus. Therefore, posterior surgical limbus is an important landmark. Then we have the pars plicatum and plana. That will be this. If you use a carved needle, just a sec. So this is a straight needle tract should be directed parallel to the posterior surface of the iris, 2 millimeter behind the surgical limbus. If it's a carved needle, it becomes a little bit more difficult. This is 2 millimeter behind the surgical limbus. It has come out the magnified view. This is a nice diagram, pars plicatum, plana, ciliary sulcus, and in front you have iris. So I would ask Dr. Meena Chakraborty to take over the presentation. I stop sharing my screen right now.